Parents have been backed up outside my office, not outside this bathroom, with lots of questions about what to do about their children having constipation. Well, let me see if I can provide the hard facts about this particular problem. Turns out that you need to realize that just because your infant or child doesn't have a bowel movement for 1, 2, maybe even 3 days doesn't mean they're constipated. It's only when your kids begin to experience discomfort or difficulty or pain in passage of a bowel movement that we worry about constipation. And in the vast majority of cases, all you need is adequate hydration and some attention to diet, and this too shall pass. So what are we talking about in regard to hydration and diet? Well, if you have an infant and you're worried about the infant being constipated, hydrate your infant with breast milk or formula if you're not breastfeeding. And if they still seem uncomfortable, you can put a teaspoon or 2 of prune juice in a bottle of express breast milk or formula, and that, because it contains a little bit of fiber, will move things along. Well, while we're talking about fiber, you need to realize fiber is ideal for treating a child with constipation. It tends to bulk up a bowel movement, soften it, and allow it to move along in the setting of good hydration. How can you get fiber in your child's diet? Well, you could do it in a bran cereal, bran muffins, bran breads. There are also fruits and vegetables that can be good sources of fiber, including spinach, peaches, prunes, dates are all good sources of fiber. Even yogurt can be an excellent source of fiber if you want to go there. What you want to avoid are banana and rice products because these tend to bind up a bowel movement, make it harder for one to pass, so you may want to hold back on those foods if you think your child is constipated. Another reason that kids can get constipated is they just don't want to use someone else's bathroom, whether it's a public restroom or a restroom in one of your friends' homes. And that's the case, they'll hold back, and that's a setup for constipation. It may also be your toddler or younger child is so busy playing, they get the urge but forget the urge, let it pass, and again, things back up. Treatment for that? Build regular toilet sitting into your child's day so they can relax and use the throne, and decelerate their play so again they have time to think about going to the bathroom. When do we worry about constipation? Well, if despite these suggestions your child is uncomfortable after several days of not having a bowel movement, they're having belly pain, or you note some blood mixed in with their bowel movement, please talk to your child's healthcare professional who can suggest other treatments that are hopefully going to help this problem. So that hopefully, when it comes to talking about constipation, with these tips, everything will come out fine in the end if you want to really think about constipation. This is pediatrician Dr. Lewis First, reminding you to always be first with your kids.